Hello, everyone. How are you? This is Pure Bliss Akram, our weekly interviews.
Hello everyone, myself Dr. Komal, and welcome to our Pure Bliss Akram question answer platform. So today we have with us Karolina Radulska, who is a health consultant, a long-term practitioner, and devoted primarily to Ayurveda, and additionally iridology, Reiki, and leech therapy. She lived and worked in many countries, among them is US, Mexico, and France. She speaks 4 languages and she uses every year globetrotting around the world.
Yeah.
So we would like to start with her.
Thank you, Dr. Kamal. Very nice being here, interviewed by you. Remember, next week I am doing the same. I am interviewing you.
Yes. So I'll start asking you a few questions and it will be a little, brief introduction about your views to the questions.
Oh,
So let us start.
I'm looking
And
forward to that.
yeah. So my first question to you is, what is Ayurveda for you? How did you get involved with Ayurveda?
I am diabetic, so I always search for many years now for different practices, alternative medicine to strengthen my body and to improve my immune barrier and immune system. And that's how a couple of years ago, it was winter before COVID, everybody's worried, flu season is coming. And I heard the story about this guy 2000 years ago. Can you imagine? And he 80-year-old guy went to a traditional Indian medicine consultant or a doctor and ask him, "Hey, this is my first time. I fell in love, and I would like a magical herbal formula so I can have family with this beautiful lady." And the practitioner went, "It will be difficult, but for you, I'll do it just for you." And this
Yeah.
is top secret. And so he received this jam really because it feels and it tastes like a spicy jam, and
Okay.
that it has 70 or 80 ingredients, right, Dr. Kamal?
Yeah, right. You're right. 18
And
ingredients we have. Yeah.
yeah, and then he started taking, and then he had beautiful family living hundreds or till 120. So I started taking Chyawanprash in winter, and it really worked, and it really got my mind totally intrigued with what is Ayurveda, the traditional Indian medicine.
And I think after watching this video, people will be more convinced rather than the advertisements that they see on TV for Chyawanprash, you know?
Yeah,
Yeah.
you got it. Yes. Yeah.
Yeah. So do you have any other story, any brief story about it related to your
Oh.
diabetes?
About my diabetes, yeah, I have many stories, but I have also another story. What I really like whenever traveling in India, you know this because you've experienced many times. After meal, after particularly heavy meal, you get fennel seeds, and this is such a
Yes.
simple thing, and it really works. This is also Ayurveda herbs for special conditions for special people. And you, do you have any others? Do you have other stories?
Being an Indian and born in an Indian family, we are using these herbs since our childhood. Our
Wow.
nannies and our grandmothers used to give to us. And that time we were not knowing that we are actually having Ayurveda in our daily life. But now, when I am into this field, I feel so glad that I was using it since many years. And now I'm just giving it to my patients to cure them. So it
Wow.
feels, yeah. Okay,
Amazing,
nice, Carolina.
because you have a first-hand experience and you also have the knowledge behind it, right?
Yes, yes. So it becomes a little easier to make the other person understand like how it works in a daily routine and as well as a medicinal herb or a medicine for them.
Yeah.
So yeah, it's a good thing for me to practice Ayurveda.
And
Okay
was
then.
there any herb that your grandmother gave you when you were growing up and that you really disliked?
Actually, the top of the list that I have in my mind is Triphala.
Oh, yeah.
because that time I was not knowing the name. I was just knowing that bitter powder. I call
Mhm.
it a bitter powder, and she used to give us so that our eyes remain strong and there will be no, decreased vision. And that's the best herb that you can use anytime and for as much as you want.
Ah,
So we will be discussing it about in our next questions as well.
okay,
Yeah. So let's move to the next question.
sure.
So, do you think Ayurveda is democratic for use by anyone in everyday life, or is it more specialized for the doctors like us?
Well, it comes from India, and India is the biggest democracy in the world.
Yeah, that's the true, right?
Yeah. So yeah, I think that's one of the wonderful things about Ayurveda, that it can be democratic. You can, if you really want the basic level, you just have the herbs for the being regular, for like asthma problems, or for evening the sugar levels after meal. But it can also be very complicated because as you studied it for 5 or 7 years, that the deeper you go, the more understanding you have, and the more complicated it gets. So it depends what you need and what you're looking for.
Well said. Because as you know, we are talking about democracy, but nowadays the way Ayurveda is becoming scientific, more scientific. So it is important to make some of the herbs patent, because people are just using it, calling it home remedies given by anyone in their family, but you have to take a proper dose on a proper time, and that too with the proper, we call it as anupan, the thing with which you have to take medicine, either it is honey or water or whatever it is.
Milk.
So yeah, milk. So this makes Ayurveda a little more scientific, and to take it like in a cautious way. So it's better we should just consult an Ayurvedic doctor or a consultant before taking any medicine.
This is actually very good. Yes, that there are a lot of research papers right now published about Ayurveda. Yes, because it's not like a hearsay, oh, this may work when the full moon comes, right? But it's all easier to understand for the Western world if you have the statistics and if you have the research done. Yes, that's very good.
Yeah. Okay, so it was a nice thing to discuss, I think. So I'll ask you my next question. So, what are your favorite herbs for everyday consumption?
I live in colder climate, so for like 6 months, just like you, right? Turtleneck right now. Cold. So I really like ginger, and I really love chai masala. Maybe it's not per se 100% Ayurvedic, but there are so many herbs in chai masala that I prepare. There's a ginger, there is cloves, cinnamon, and it all hits you up. So I really like in winter taking the herbs that increase my circulation, and they make me feel warm and well taken care of.
So, are
And
you taking it
yes,
like in a seed form or making it a powder of all of them?
I usually grind them just before serving because that's what Ayurveda teaches us, right?
Yes. Right, right, right. You should prepare it freshly,
Yes,
just grind it whenever you need it. Yeah.
exactly. And your favorite?
Yeah, I would say being into more into women's health and gynecology. So
Oh,
my favorite herb is and used to be Shatavari. I think it is used as a salad also in some of the countries, and here in Australia as well. We use it a lot in our salads because
wow.
we call it as a woman's best friend. If you say it's that's Shatavari,
I
asparagus samosa. Yeah.
actually I like the other name, the X-rated name, the woman with 100 husbands.
Yes, that's true. With 100 husbands, yes.
Yeah.
So that's very helpful for a female in many ways. And it's not like that a male cannot use it, but that has to be used in a different way. But most of the times it is more beneficial for women. So I personally use it, so I like it. The taste also, it's sweet in nature and the taste is sweet. So
Oh,
easier for the patients to take. Yeah. So that's one of my favorite herb.
very good. Actually, very good for people and for women entering menopause, right?
Yes, yes. It helps like it's a wonder herb. It will balance your hormones. If it is on a higher level, it will bring it down. and if it is in a lower level, it will bring it to the normal. So that's way it works very magically.
Wow.
So I like it.
One of
Yeah.
many in Ayurveda. Okay.
Okay, so I think you have told me your favorite Ayurveda drink, right?
Yes.
Okay. So I'll be moving it to the next questions.
Yeah.
Some people say that in our times, in time of pandemics, we just stay at home and be vaccinated. How does Ayurveda prepare us for the times and to build a strong immune system? And what herbs do you use for that purpose or in that time?
This is a question as much for me as it is for you, but I can speak from my first-hand perspective. Of course, Chyawanprash is wonderful, but I remember that when we have the first closing for winter, our entire family moved to an island that was totally open, and only people wore masks, but not so many. So I was
Okay.
kind of afraid, since we knew so little about COVID, and we knew the stories were incredible. Just open YouTube and you have a
You're talking
journey.
about the
Yes,
year 2020? You're
yes,
talking about it,
exactly.
right? Okay.
Yes. So I took with me and I fed everyone guduchi, and the guduchi really work, and of course curcuma and
Yes.
turmeric to strengthen your blood and things like this. What about you?
Yes. Actually, I would like to talk about a different perspective because I think what you have told and what everybody knows is the one side of the story. But what I have seen during that COVID time, I was doing my duties. I was not at home and I was just consulting patients that time as well
Wow.
because patients were, running towards Ayurveda that time because they came to know that there is no particular medicine in allopathy medicine and there is no particular injection for that, only that vaccination thing was there and that was not protecting people from getting the illness.
Yes.
So I have seen people getting sore throat and the inflamed throat because they were just taking blindly all these things, that herbs, and that was just causing another problem in their body. So
Yes.
I would suggest that please take everything in a cautious way and under a complete observation.
Very
Because at that
important.
time, there were a lot of Ayurvedic doctors providing online consultations to the patients because people were not able to go outside their home and see a doctor. So we were there at that time. So I would like to suggest everybody, like, whenever you take any herb or anything, just, read your body first. Like I have seen more of these problems in Pitta Prakriti person, they are more tend to get such things. So yeah, the herbs that you have told are magical herbs and they do wonders. But the dose is very important. Yeah.
Exactly. Yeah, well said, very well said. Also, how you take it, right? And if you take
Yes.
it with what apana you take it, and then what
Yes.
constitution you have. Yes,
Yes.
that's another
And how much
important
quantity
thing.
in a day you should take. So that's all very important.
Yes.
Yeah.
Mm, well said.
So we have a good really conversation with about it.
Hmm.
And now we'll come to Panchakarma. What
Uh,
was the weirdest Panchakarma have you experienced in your trip to India whenever you came here?
Actually, Panchakarma, it's a very calming experience, and you know that because you are a Panchakarma expert, right?
Yes. Uh-huh.
Most of the massages are very relaxing and very nice. The one thing that did much more than I expected was Shirodhara. And you have a warm oil in a copper pot just above, laying down just above your third eye, and
Yes.
good on your third eye, and you think, okay, okay, when is it done? Okay, my vata energy started looking around the room. Okay,
Yes.
when is it over? And then it calmed me down, and then I fell asleep, and this was really very magical.
Yeah. So you liked it overall?
Yes, yes, very much.
That's great.
And
But
yours?
for me, Nasya is something which is little weird. When I first took it, it was like, okay, they just put some oil in your nostrils and it feels like it is going into your throat and you feel like spitting it out, but they'll ask, no, you just have to take it inside.
Yes.
And And not that's just all. After that, they will just give you a medicated smoke. That's a very weird thing to take, but personally, I like that thing a lot. Because being a Kapha Prakriti person, I have this tendency to have blocked nose very frequently. So I just take it at home as well sometimes under my own observation.
Remember
So it's,
the salt purgation with salt
yeah.
water? That was something else.
Actually, that's something I think most of the Ayurvedic doctors think twice before introducing that to the
Yes.
patient. So that's not an easy one. Yeah.
Thank God for the patient. Yeah.
So for me, that's yeah. Okay. So we have few more questions to ask.
Yes.
How do you think Ayurveda can work together with allopathic medicine? Like, if
That,
I ask you
yes. That is,
diabetes and
yeah.
to prevent complications, how would you describe it?
That's actually a wonderful combination because allopathic, sometimes we talk negatively about allopathic medicine, but allopathic medicine in case of trauma, in case of tumors and cancers, the final stages, I think does very well for the patient and saves millions of lives. So,
Yes.
in case of chronic diseases, Ayurveda works very well because allopathic medicine tends to concentrate on the disease. And
Yes.
Ayurveda concentrates on the reason and on the reason why that particular person, why Karolina has diabetes, right? And how can we balance that energy, that chemistry in the body proven by the modern science. So that's what I love. And that's, we had a patient in Pure Bliss Akram who had ovarian cancer and yes, and after removing most of her female organs, she couldn't have the hormonal therapy, right? Since she couldn't have hormonal therapy because there was always a risk of the cancer coming back, then the doctors, this was a young female, told her, well, you have to eat properly, you have to exercise, etc. And then the estrogen, progesterone level, her density of the bones, and many things just got not ideal. And for that, for things like this, working with cancer patients, I think Ayurveda has incredible supplements and supplements especially designed for the patient, not for, everybody has the same problem because everybody has the same chemistry, everybody has the same metabolism and body. No, Ayurveda does it especially for the patient. And that's what I love.
An individualized treatment, what we say in Ayurveda. But what people are taking it just the opposite, that it's the same for everybody, and any herb can be taken by everybody. So it's not like that at any cost. Yeah.
Yes.
And I'll talk about, like, some of the therapies are there for your liver cleansing and your gut cleansing.
Yes.
And the term colon cleansing is very common nowadays, used by so many people who are not even aware about Ayurveda. How does Ayurveda do it?
Yes.
So we are just doing it as a Panchakarma procedure, and it helps a lot with patients of, acidity, hyperacidity, with patients of gastritis, and a lot of pitta problems, and liver toxicity as well, fatty liver. In such cases, it helps a lot.
Yes. You have
So
to do it in Ayurveda twice a year, right? For spring and for fall, before
yes,
winter.
yes,
Yeah.
it's called purgation.
Yes.
It's called medicated purgation, and videchana. We called it in Sanskrit as videchana, and that can be taken by an healthy person 2 times a year.
Mm.
So that way, it's a way to cleanse your body on your own without visiting the doctor as well. Yes,
It works incredibly, particularly for me. I do it twice a year and it's really magical. Yes,
yes. We all do it because if we are doing it, then only we'll be able to explain it to our patients. We are
exactly.
also doing it on ourselves. Yes. Yes.
Yeah,
Now, is yoga a part of Ayurveda? What do you think about it? How do they work together if it is there?
absolutely. It's part, it is a wonderful part, a branch of Ayurveda. And from my personal experience, like around 30% of autoimmunological diseases, after the first organ fail, then there's also another organ. And in case of diabetes, very often it's thyroid. So yoga has, what I've learned on myself, autobiographical experiences. Yoga has wonderful exercises that improve the circulation of blood and oxygen to thyroid, and it really works magic. Yeah.
You said it right, because yoga, as we used to study in our second year of Ayurveda study, yoga is a subject that comes under Swasthavrita, and it is a part of Ayurveda. But nowadays it is recognized as a separate science, and that's a good thing as well. Because being a part of Ayurveda, it was taken as a secondary thing and as a secondary option, but now people are just taking it as a very important thing in their lives to have a healthy life and to rejuvenate their life as well.
Yeah.
Along with taking Ayurvedic supplements, we should do yoga in our daily lives as well
Yes.
to remain
We
fit.
should have the dinacharya, right?
Yes.
Dinacharya, sorry. The daily routine, that's
So,
another very important
yeah,
thing. Yeah.
right. Yes. So, yoga comes under that as well. So, it has a lot of importance in Ayurveda.
And we actually have a very interesting article written by another of our doctors, Ayurvedic doctors, Dr. Siddhartha, about the daily routine. And this is every day for the rest of your life. So you look beautiful and young, and your mind works like AI.
Yeah. So, it not only helps you physically, but helps you mentally and emotionally as well. So,
Exactly.
to know more about it, you can just read the article on our website of Pure Bliss Akram anytime.
Okay.
So, okay, Carolina, is Ayurveda a religious practice according to you? Do you
Uh,
think so?
Religious, no, but spiritual, absolutely yes, yes. Because as we know, all the diseases really start in our mind. So if we are able to calm our mind, then we are healthy people.
Yes. And being spiritual is very important nowadays in this world of stress, anxiety, and depression. You need spirituality in your life. Yes, right.
Uh,
Okay, so for the bottom line, what rating do you give to Ayurveda? Like, what do you think? Will there be any cons as well? Not always pros, but some of the cons will be there, according to you, if you think so.
there are a lot of pros. One of the cons that I can think of is the right now the popularization of Ayurveda. So you have so many websites. Or what is your constitution? Are you Vata? Are you Pitta? Are you
Yes.
Kapha? Oh, if you know this, you can buy my cosmetics, or you can buy magnesium supplement in 3 grams, 6 or 10 grams. So that's the problem. That's what you were talking about, that your patients from the pandemic times, right? When you have patients who really actually did damage to themselves, but because they took it incorrectly or inappropriate herbs for that condition. So that's like in any medical practice, Ayurveda is also very complicated, and that's why it's good to go to people who actually studied Ayurveda and know what they are talking about besides the constitution. That
Yes.
usually you have two constitutions combined. You are never Vata. Yeah. And sometimes you are Tridosha, but then you have hard time living. Yeah.
And we will be explaining this Tridosha theory in our upcoming interviews to our patients and our viewers.
Yeah.
So that was a great answer, Carolina, because that's the only thing Ayurveda is lacking, and that's the awareness about it. But we all are just trying to work on it and making it a scientific study more than home remedy thing. Yeah.
Exactly. Yes, we're trying to really bring Ayurveda from the scientific perspective, because from the quality of cure, I think it's already there. But from the
Yes.
scientific perspective, so we can have all these difficult words, in Latin,
Yeah.
describing every herb that we have. And how many herbs are they in Ayurveda?
It's like infinite. You can't just count it. Yeah, and that too, all are multitaskers. They are not helping you in one thing. You're helping you in a lot of things. Single herb. Yeah.
Yes, exactly. That's what's wonderful. Okay.
So it was a nice conversation, Carolina, and we'll be back with our more such interviews.
Okay. Very nice talking to you, Dr. Kamal, and looking forward seeing you next week. Namaste.
Thank you. Namaste.